Hello, my name is Sara Pocknell. I'm an occupational therapist and I'm currently studying at Cardiff University for a PhD. My presentation today is making a difference to adult cancer care in partnership with Aneurin Bevan University Health Board, the Knowledge Economy Skills Scholarships, CAS2, and the Welsh Government European Social Fund. And I just wanted to give you an overview of my research project. We know that cancer is now considered a chronic condition, which requires a new approach to longer-term care and survivorship. It is predicted that by 2030, 4 million people will be living with a diagnosis of cancer. Multidisciplinary teams treat cancer patients. However, there is conflicting evidence to demonstrate the effectiveness of multidisciplinary teams. For example, in 2017, Cancer Research UK commissioned a survey which findings suggest that the maximum time is 6.3 minutes for any patient to be discussed at one of these multidisciplinary team meetings. However, much of the evidence and journals refer to multidisciplinary teams without explicitly mentioning allied health professionals. My research wants to change that. The NHS Wales is split into 7 health boards, and my current research is here in Aneurin Bevan University Health Board, South East Wales. The population within this health board equates to approximately 19% of the Welsh population. In 2016, the Welsh Government produced a cancer delivery plan whereby it wanted to achieve the highest standard of care for everyone with cancer. The Aneurin Bevan Health Board have recognised that there is a disparate growth in cancer care services and have part-funded this study to research how allied health professionals contribute to adult cancer care. Allied health professionals are diverse, valuable public health experts and deliver high-quality, person-centred care, and within Wales they make up the 3rd largest workforce in the NHS. The 7 allied health professionals that will be explored are listed here. So we've got practitioner psychologists, podiatrists, occupational therapists, dietitians, speech and language therapists, physiotherapists and orthotists. So for example, dietitians can advise and educate individuals with the most up-to-date health and scientific research regarding nutrition and provide individualised eating plans, which is vital for the care of cancer patients. Another example, speech and language therapists are instrumental in assisting head and neck cancer patients, or orthotists who can assist with the effects of chemotherapy, such as peripheral neuropathy. These 7 allied health professionals are all registered with the Health and Care Professions Council. Healthcare professionals will be aware of flowcharts or flow diagrams, such as this one here on the left. This is a patient pathway to assist with planning services, multidisciplinary management tool, or a route which a patient is expected or likely to take through services. However, it could be argued that many patients and staff feel the pathway is more often like this one here in the middle. And in an ideal world, we would want it to look like this, the one on the right, where patient-centred care is truly at the centre. Moving on to evidence-based practice, the underpinning tenet of research is to generate knowledge and in healthcare to provide an evidence base to inform the practice, and we would hope make a difference to the patient. However, we know healthcare, particularly cancer care, is multifaceted and complex. So by using a particular theory, such as complexity theory, this will allow the researcher a particular lens to view the project, and as Chandler and others in 2016 suggested, is a transdisciplinary science. Healthcare systems can be a dynamic process, which is characterised by constant change, and as Plask and Greenhouse suggested in 2001, linear models of care must be abandoned. But moving on from complexity theory into complex adaptive systems, this further recognises not just the complexity, but the many agents involved. And within this project, there will be many agents, such as the Welsh Government, the Health Board, staff, and more importantly, patients and their families. So how do I hope to make a difference? The aim of my project is to develop a service delivery model for the allied health professionals, the 7 that I mentioned earlier, working within adult cancer care in Aneurin Bevan Health Board. And using a mixed method design, that is a quantitative and a qualitative approach. I will first collect data from staff by means of a questionnaire, and this is purely for a mapping exercise, and then semi-structured interviews with staff and patients. And I feel absolutely passionate about the patient having a voice. So that is a really, really important part to my study. Mixed method research can offer integration of both quantitative and qualitative methods by complementing each other, and is gaining momentum within healthcare research. Finally, I just wanted to add, after my overview of my project, I just want to say a big thank you to members of a patient advisory group which were recruited with the help of Health and Care Research Wales. These members were invaluable in providing advice and feedback. So, for example, they were able to look at participant information sheet and interview schedules, to name but a few. So without them, again, that patient having a voice, I think it was really, really important to making a difference. And that's the end of my presentation, and thank you for listening.